Good morning. This is Dr. Kishan from Ayush Scan Center. This is antenatal scan, and as we try to look at the fetal kidneys, we start seeing that there is a pelviectasia. This is a fetal renal pelvis, and this is a cardiac apex left side. This is right side. So when we try to look at the kidney, the right kidney is having pelviectasia and mild hydronephrosis, and the left kidney is normal. There's no hydronephrosis, and when we try to look at the bladder and in axial plane, this is the bladder, and when we try to look at the bladder in the coronal plane, we see that the bladder is more like a shape of a top, and when we try to focus the bladder neck, this is how it is seen. It is seen as a top appearance. So whenever we get this type of an appearance, we should also look for a bladder neck. Next line, when we try to look at the bladder neck, in intermittently we got this. This is the posterior urethral valve, and this is the posterior urethra which is dilated. This is a classical top appearance in urinary outflow obstruction due to posterior urethral valve, and this patient initially just presented with a mildly over distended bladder. We had called for a follow-up, and then only mild right renal pelviectasia was there, less than 4 mm. So on the follow-up after 10 days, we were able to demonstrate that the renal pelvis is mildly more dilated, only on one side, and there is mild hydronephrosis, and the bladder neck, as you can see here, even now when I am demonstrating the bladder neck, the posterior urethra may not become visible until it is getting ballooned. So when we patiently try to demonstrate weight, see here you can make an observation here, and then there is a posterior urethral valve, and in this particular image it's very classical. So whenever you see mild pelviectasia also, it's very essential that we should look at the bladder neck very carefully and also at an interval to demonstrate a posterior urethral valve. Thank you. Dr. Kishan, Ayush Scan Center.